Well, thank you for coming back again. Now, it is, believe it or not, Sunday the 19th of April. And what I wanted to do on this first reflections today is look at some people's experience of this illness, or what we suspect to be this illness, COVID-19, because it's very frustrating that we've got so little formal diagnosis with testing. But yesterday, for example, we looked at the story of Benin from who was in Hong Kong, and we looked at Benin's history as they'd recorded it on this chart. Now, I'm going to make an unreserved apology to Benin because I referred to her as he. Benin is a woman, so my apologies, Benin. I am so sorry. We'll know for next time. But thank you for sharing your experience. We really appreciate it. Now, I got another one today from Angela. Angela wrote to me, and she's just made up a roan at home. So this is her illness from the 26th of March. She'd actually written this down on a calendar. And then when she watched yesterday's video, she kind of transcribed it onto this. But it's good that she'd kept a record, but it is nice to see the record in this more organised way. So the first day of Angela's illness was the 26th of March, and she presented with headache and this dry feeling in her mouth and her nose. And that's all the features she complained of at the time. And then we see on days 1, 2, 3, 4, 5 and 7, she had headaches. And then she developed this sore throat. And she describes this as a dry throat rather than a sore throat. And dryness of the nose and mouth on these days 1, 2 and 3. And then the cough didn't start till day 1, 2, 3, 4, 5, 6, 7. So 7 days after the onset of symptoms, she developed a cough. Now this 2 here is a really good idea. That indicates how bad it was. So her cough was quite bad there. It was a 2 there. And then her cough went down to a 1 there. Became a little milder in that area there. Then she got a hoarse voice on those days. Undue fatigue on these days. And then the breathlessness didn't develop until day 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. And she had breathlessness for those 4 days. And still, even a week or so, 2 weeks after now, more than 2 weeks after, still has a degree of shortness of breath on exertion. So a good record there where Angela was just able to write down the symptoms that she experienced. So let's leave that chart now and talk to Angela directly. I think we might be working. Right.
Okay.
Right, Angela, it's really kind of you to talk about your experience. Would you like to tell us what happened to you on around about the 26th of March, I think, was it?
Yeah, on the 26th of March, I had this awful headache. I don't get headaches, so I didn't think too much about it on the day. But it
Was it the front or the back, or?
Hard to say. It was just all over, a very heavy feeling in my head. It was accompanied by a very strange dry sensation in my nose, throat, and my eyes. That's how it started. I did use some eye drops because my eyes were getting sore, probably from the dryness. I did increase my drinking because I was thirsty because I felt dry. That was day 1. Same thing on day 2. Day 3, I had a sore throat, but I can't explain it. It was more the dryness that caused the sore throat. It wasn't like what I call a sandpaper throat that I get when I get a cold.
Did you feel you were producing saliva, or was it just?
No, I wasn't. It was all very, very dry. All dry. My nose, eyes, throat, very dry. And the headache continued like that for about 3 days. On day 4, my voice started to go, even though I wasn't really speaking to people because we were on lockdown. But my voice started to get hoarse. And then I'd sort of seen some of the politicians, I think, talking with a hoarse voice who had had COVID. And I thought, okay, this really is what I think it could be.
Yeah.
And then, of course, the next day I had fever. I didn't have a thermometer, but I was hot. I was hot, burning up.
So it's a feeling you recognise, isn't it?
Yeah, it is. Yeah. And that day I had to go back to bed. And I think I stayed there most of the day, got up again at 5. Just
How
felt
bad did you feel, Angie? Did you feel absolutely awful, or was it sort of just a bit
I
ill?
can't,
Or
no, I can't say I felt dreadful, but when you have the flu, your body just won't go. You've got to stop and give in. That's how it felt.
yeah,
I didn't have body aches like you get with flu, and I didn't have mucus, snotty cold, nothing like that, just the dryness. And so I spent 2 or 3 days trying to get up and about and ending up back in bed. And then I gave up and spent the next day in bed because I thought I've just got to try and let this go on its own.
I think it's
Um,
very important to rest. I mean, I'm like you. I
yeah,
try and work through things, and
yeah,
it's really not a good idea in the long term. I don't think you got to.
no, exactly. And then the following day, which would have been day 8, I started to get the dry cough,
So the
which was
cough
quite,
came quite late then in your illness.
it did.
Yeah.
It might have been, it was a cough that wasn't like a tickly cough. It wasn't a wet mucus cough. It was, I don't have asthma, but I would imagine it was like an asthmatic sort of cough in the trachea, which you can't find any reason why you're coughing. Again, it wasn't horrendous. It was just off and on. Um, Something that I haven't put on here,
Yeah.
which may or may not be relevant. I got night cramps for around the nights where I had the fatigue and the fever. I got night cramps in the night in my feet. I don't normally suffer from cramp. Maybe once or twice a year I get something, but I had it 4 nights in a row, which was interesting.
And unusual for you. That's the point, isn't it?
Unusual for me, yes. Over the next 4 or 5 days, the cough continued.
Did you start coughing anything up, Angela, or did it always
No,
stay
not at
dry?
all. No, it was always dry. What I did on about day 10, and I'm thinking, day 10, this is where it's going to go one way or the other. I was thinking, because that seems to be how it goes.
I think Boris went into hospital on day 10, didn't he?
Yeah, I was on the same time frame as him, I think.
Right, right.
I
Uh,
started doing when I could, when the coughing sort of wasn't quite so bad, which if you see on the chart, I've got a 2 by the cough, 2 out of 10. Again, not that bad. Then it went down to 1 out of 10 for the last 5 or 6 days, just in the background, really.
it's
But
another
once the
brilliant idea, Angela, to try and quantify your symptoms, how bad
yeah,
it was. That's a really good idea.
yeah. So once it got down, I started my exercising, which I've been doing because I had a bad motorcycle crash last year, which laid me up with a lot of upper body broken bones and a badly bruised lung. And I was taught to do the deep breathing exercises in the bottom of the lung to get the air moving around in that area. So once I was able to do that, that's what I started doing with my exercise loops I do around the garden, which is all sorts of strengthening exercises I'm doing. But I was incorporating those deep bottom of the lung breathing exercises because I was thinking, I don't want this to get down there. So
Did it seem to help?
I don't know. There's no way of knowing that, but it made me feel better to know I was breathing properly in the bottom of my lungs, getting more air in, getting more air out, lying on my front, opening up the airways, which is what I was taught to do.
Yep.
So whether that helped or not, I don't know. I think it has to, because when you're in a hospital bed, they tell you got to get these deep breathing exercises to stop you getting lung infections.
Absolutely, yeah.
So maybe that helped. I considered that it might, so I did it. And from there, the symptoms started to get better. The hoarseness went, the fatigue went. I was left a bit breathless from day, where have I got that down? Breathless,
5th of
day 10,
April.
11, 12, 13.
So, how did that feel like? What did the breathlessness feel like?
This was, it wasn't there unless I did something. By that, not very much. I went out in the garden, I started to move some bricks around. I moved about 4, absolutely breathless.
Short of
It
breath
just,
on exertion, yeah.
yeah, that's right. It was that. So it wasn't during normal activity, it was on exertion. And that surprised me because I'm quite active. That
So prior to
surprised
that, you hadn't felt short of breath, or
me. No.
but you have this sort of strange feeling in your breathing at all, or did your chest feel normal before that?
My chest felt normal before that. Yeah, it was the cough right at the top that was
Yeah.
It's like a cough for no reason. I can't explain that.
But this basically, I mean, obviously, you and me have been ill many times, and
Hmm.
this felt different to other illnesses that you'd had in the past.
Definitely. Yes, definitely. Yeah, no doubt about that. Yeah.
And so you started being ill on the 26th of March, Andrew. It's now the 19th of April, isn't it? So that's what,
Yeah.
5 weeks
20,
ago ish.
four nearly.
Four, yeah. How are you feeling now?
I'm okay now. I just got this slight hoarseness, but apart from that, I'm okay. Yeah, it's about day 24 now. And
Right, and your
I,
cough seems to have resolved now. That's good.
yes, that's gone. Yeah, that's gone. Yeah, yeah.
Right. Just slightly personal question. Did you have any diarrhea?
No,
Right, because quite a few
no,
people do. And did you have any nausea and vomiting?
no, none at all. In
Right.
fact, about 3 days before I had this, I was ravenous, really hungry, really hungry.
Interesting, because that you
Yeah,
would be incubating it at that stage, wouldn't you?
yeah, yeah.
Right. Yeah.
That was interesting.
Yeah.
That was unusual because I just basically I eat for fuel. That's how I eat. I eat every 2 hours. I eat for fuel. But I was really hungry a few days before, and about 5 days before, I had something like conjunctivitis. Whether that's related or not, I don't know. And I've not had that before.
It's interesting because the virus would be in your body at that time, wouldn't it? I mean, most people
Yeah,
incubate for about 6, 7 days.
yeah.
Yeah. How's your health normally, Angela? Just anything you feel you can tell us.
It's fine, fine normally. Yeah,
So you're
yeah,
normally fairly healthy and active.
yeah, 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 yeah.
Yeah, and you've got a range of interests and everything. That's
Oh yeah,
yeah,
loads.
yeah,
Always.
yeah. Now,
Yeah.
do you know how you caught this illness? Because I know you've been self-isolating, haven't you?
I hadn't been out for 4 weeks before that date, before it started. So I haven't been in supermarkets touching trolleys. I haven't been involved in any of that. I have customers who come to the house. Last customers were here on the 16th, 17th, and 18th. That was nearly the week before. Um, three customers, they were only in the house for 5 minutes probably. So they hadn't got any symptoms. Uh, I know that one of them hasn't got any symptoms because I've spoken to him since. So I don't really know. Unless
The timing's right there, isn't it? So it's about a
it
week
is
before you
right.
develop your first symptoms.
I'm also thinking I had deliveries in the post before that as well, couriers before the lockdown. So they were actually coming right to the door. So there were a couple of other people here as well. Again, symptomless. So obviously from somebody, probably not from touching things out in the open because I haven't been there. And I haven't been out since either, obviously.
And
So
you're washing your hands and things when you came back in the house.
I was paranoid about that. I've been doing that for a long time. My hands were raw from washing.
Yeah.
Got the disposable gloves. You know, I mean, I name it, I've got it. I'm cleaning door handles, everything. I've been really careful, ultra careful to the point of being paranoid, perhaps. But I didn't want to catch this. But somehow
It does
it
sound
seems.
like those visitors in the early stage, doesn't it?
Yeah, I think so. I think
From
so.
the timing, that sounds like. And of course, we now know that so many people who have this infection are asymptomatic,
I know.
but
Yeah.
they can infect others. That's one of the reasons this
Yeah,
is
yeah.
so
Yeah.
dangerous and a spread.
Yeah. Scary. Yeah.
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 Now, did you contact healthcare providers during your illness, Angela?
No, I didn't. I looked on the 111 helpline and it said you've possibly got you possibly got COVID, isolate for 7 days, it said, which obviously I was doing anyway. I took the phone to bed with me just in case I needed any sort of help, which is, sort of sensible advice, I guess.
So that's good.
Uh,
You felt you didn't really feel in danger. You felt like you could manage on your own.
yeah, I did. Yeah,
Yeah.
yeah, yeah.
You must have had quite a bit of anxiety during the illness, though, kind of waiting for this 10th day to
I
tick around. And
did. I did. I
yeah,
absolutely did. Once the fever came and the cough came, I thought, I know what this is. And then I thought, I'm on day something now. It's going to be day 10 shortly. If I can get through to day 14, I'll probably be okay, I thought. And that was what I was sort of aiming for,
yeah.
just to get past that 10 to 14 day stage. The fever was short lived. That was only a couple of days. So I figured that once the fever had gone, I was possibly over the worst, I think. Whether that's true, I don't know, but I think that's possibly the case.
Yeah, I think the kind of jury's a bit out on that one at the moment, really. People
Right.
that do get ill, the symptoms often do persist beyond the 7 or 8 days.
Yeah. Yeah.
Um, but there again, people can have fever, then it can come and go a bit, so it is a bit unpredictable.
Right.
It's a
Hmm.
very strange illness.
It is. Yeah.
Yeah. Now, did it? So obviously, if you've never been tested, you didn't contact a healthcare provider.
No. No. I don't think I would have got tested anyway, to be
No,
honest.
I don't
Right
think
in the
you
middle
would.
of the tests. Yeah. I'm looking forward to an antibody test. I'd like to know. Absolutely.
Absolutely,
Yeah.
I would love to know. From what you've said, I'd be amazed if you hadn't had it. I mean, just the fact that
Yeah.
you felt so different to any other illness you've had before.
Yeah.
It's a new
Yeah.
novel thing, yeah.
Yeah.
And so hopefully now you're immune. This is what the great hope
I
is.
hope so. I don't want it again.
We are hoping this. I mean, vets are very experienced with coronaviruses, and they tell us that it's likely to get immunity. It's just that it might not last for very long. But
Well, let's hope it lasts until we get the vaccines
well,
out there.
I think it should last until we get the vaccine.
Yeah,
Yeah,
that'll be
I
good.
really hope that's the case.
Hmm.
Anyway, I'm delighted you're feeling better now, Angela. So you're just sort of
Yeah, thank
returning
you.
to normal duties gradually, but
Yeah, yeah.
just this still a bit short of breath when you're trying to do anything. So
Yes, I am a bit. Yes.
yeah.
Yeah, yeah.
What was your eating like, Angela? Were you feeling? Did you eat through the illness, or did you feel?
I didn't eat as much as I normally do. I have these supplement drinks which I had a year ago when I had the accident. So I do have things in the cupboard that I could have as substitute. So I did keep the calories up. I did lose 4 or 5 pounds. I've now got most of that back on. So yeah, fine. I only eat sort of fruit, vegetables, my own food. So I eat very healthily anyway, normally. So
Sure.
that was probably a good start.
And you were able
Yeah.
to keep drinking water all the way through.
Absolutely. Still am. Still
Yeah.
am continuously drinking.
So waterworks wise, everything seemed to carry on as normal.
Yeah.
Yeah,
Yeah.
producing
Yeah.
urine normally and things like that.
Yeah.
Yeah, yeah.
Yeah.
Right. Anyway, I'm just delighted you're better now. And of course, most people are like you. Most people have a well. I'm not going to call this a mild illness because it wasn't. It was a significant illness. But you
Yeah.
made a full recovery without medical intervention. So
Yeah. Yeah. That's good.
that's wonderful. Yeah. Angela, I really think a lot of people watching this will have their anxiety levels lowered quite a bit by what you've been kind enough to share with us. I think it's
Oh, right. That's good.
yeah,
That's
I
good.
really appreciate that, and I'm sure many other people do, and I'm sure there'll be lots of emails ringing in saying thank you, thank you, Angela, for
Okay.
for doing this. Yeah, yeah. As long as my recordings worked, of course.
Yeah, that'd be good.
Thanks. Now, I've got another really good idea I want to share with you here. Now, I do apologise, I've forgotten who sent this in, so if you let me know, I'll make sure you're fully credited tomorrow. But I've had so many emails lately, I've actually lost the original email. But I like this as well because this is based on the chart we looked at yesterday from Dr. Sun. And we have the days of the illness here. Of course, this could be extended if necessary. I do hope it's shorter than that. And we have these things to look out for. So as you would expect, we've got things looking for temperature and pulse. That would be good. To include the heart rate on it would be very useful clinical information, as we do in hospitals, in fact. The breathing rate per minute is good to monitor. Remember, one breath is one breath in and one breath out. If you have one of these home blood machines, blood pressure machines, then by all means, of course, take your blood pressure. And if you've got one of these home oxygen machines that we've looked at quite a few times, these ones, these saturation probes, these are about $20 now, so they're actually reasonably priced. So if you can monitor your oxygen saturations, that would be remarkably interesting to a healthcare provider. And then the cough, and then you can put the number in there for how severe the cough is, as we saw Angela did. The sputum or the phlegm, the sore throat, the runny nose if that develops, any shortness of breath, muscle joint pain, headache, fatigue, diarrhea, nausea, pink eyes, and this feature called anosmia, loss of smell. So that's all very useful information. All very useful to collate that, to watch the trend of the illness, because in healthcare, trends are so important. We want to know how ill someone is, but the history and the trend is absolutely vital clinical information. So really, I would advise everyone to start collecting information for themselves or their relatives if they're sick. But the other thing I liked about this and I will tell you who developed this when they tell me. I'm sorry. There's features in red here that means we should seek healthcare advice. So shortness of breath, difficulty breathing, pressure in the chest pain, cold, clammy, mottled skin, new confusion, becoming difficult to rouse, this blue colour in the lips or the face. Now I get asked repeatedly, how do you tell if people with dark coloured skin are going blue? Well, the answer is you look at their lips and you look in their eyes, you look at the mucous membranes, you look in their tongue. But with experience, you can tell the difference in skin tone anyway. But that's the key thing, looking at the mucous membranes and indeed the fingernail breads. Little or no urine would be an alarming feature. And neck stiffness and non-blanching rashes we looked at are related to meningitis. The non-blanching rash means that when you put a glass over it, the rash doesn't fade. You can see the rash clearly through the glass. So these would be emergency situations. Now, I think if someone like the governments were to publish this officially, this would be really useful for people to keep a record at home. And it would also mean that people that were deteriorating and the minority of people that do need medical care could get that in an early, timely fashion. So if anyone's in charge of the health service or anything who's watching this video, I really suggest we have a national one of these, because I think it's useful for the individual, it's useful for members of the family, it's useful for reporting to healthcare to give accurate histories, and it's also making people readily aware of any possible symptoms related to deterioration. And it would be really useful if we had one that was the same all over the country, so we could have a standard sort of a pro forma on that. So if anyone's listening, I really would think that's a good idea to have a national standard version of that. And this same person also gave me this extra sheet that we could think about. So again, information about you as the individual or the family member, medication, supplements, vaccine history, smoking. Obviously everyone stopped smoking now. Hopefully people are stopping vaping. And it's useful that people do smoke other things, of course. So all useful clinical information that's well worth collecting, because bear in mind we are dealing with a respiratory condition here. Travel and contact history, we know this is community acquired now. Treatment history since becoming ill, past medical history, social history, information about self-quarantine monitoring. All these things are incredibly useful to healthcare providers. So, I mean, what the government could do is they could have like that on the back of a sheet, and this or the first one on the front of a sheet. And I just think that's a really good idea. So do send me your name in, and I will give you full credit for that, because it's very well compiled and I'm very grateful for that. But if you can't get hold of these at the moment, then just do what Angela did, and I'll see if I can make this one available actually as a download somewhere. I'll look into that. I'll get some technical person to help me with this. But remarkably good idea. So that on the front and the other information on the back would be most useful.